Hello and welcome everyone. Myself Mizanur Rahman, and today my topic of discussion is anemia. So let us start. First of all, today we'll try to introduce, then classify, and try to tell the signs and symptoms of anemia. So let us start. First of all, introduction to anemia. So what is anemia? First of all, anemia is a blood disorder. So what is this? It is a blood disorder characterized by the reduction in red blood cell count, hemoglobin content, and fat cell volume. So what it is? It is basically the blood disorder which is characterized by the reduction in the red blood, either red blood cell count or hemoglobin content or fat cell volume or both of these. Then generally the reduction in RBC count, hemoglobin content and fat cell volume occurs because of the decreased production of RBC or increased destruction of RBC or excess loss of blood from the body. So these are the basically three major reasons in which the reduction of RBC occurs. So in which case decrease in RBC production, increase in destruction of the RBC and excess loss of the blood from the body. And all these incidents are caused either by inherited disorders or environmental influences such as nutritional problem, infection and exposure to drugs or toxins. So these incidents are caused either by the inherited disorders or the environmental influences such as nutritional problem, infection and exposure to the drugs or toxins. Now classification of anemia. There are two classification method for anemia. One is morphological classification, one is etiological classification. So let us start with the morphological classification. So first of all, the morphological classification, it depends upon the size and color of RBC. So the major contribution is from the size and the color of the RBC. Now size of RBC is determined by mean corpuscular volume or MCV, which we have already discussed in our previous videos, and the color is determined by the mean corpuscular hemoglobin content or MCHC. Now by this method the anemia is classified into four types. What are these four types? Here are these. One is normocytic, normochromic. In case of this, the size of RBC is normal and color of RBC is also normal. And number two, that is normocytic hypochromic. That is, in case of size it is normal, but in case of color it is less colored. Then macrocytic hypochromic. In case of this, the size is large and the color is less. And microcytic hypochromic, the size is also small and the color is also less. These are the major four classification. Out of this, you can also found another classification also. Now let us start with the normocytic normochromic anemia. Here the size or MCV and the color or MCHC of the RBC are normal, but the number of RBC is less. So what is the reason? In case of this, the size and color, you will found that these are absolutely normal, but the number of the RBC is less. Now number two, that is the macrocytic normochromic anemia. In case of this, the RBC are larger in size and with normal color, but the RBC count is less. Then macrocytic hypochromic anemia. In case of this, the RBC size is larger but the MCHC is less, so the cells are pale or less colored. Then the microcytic hypochromic anemia, in case of this, the RBC are smaller in size and with less color. In which case you will found the normochromic normocytic anemia you will found in case of accidents, where the RBC is lost, where the blood is lost, but in case of that the RBC count is less, but the MCV and the MCS is absolutely normal. Now come with the etiological classification of the anemia. On the basis of etiology or study or cause or origin of anemia is divided into five types. One is hemorrhagic anemia, one is hemolytic anemia, one is nutrition deficiency anemia, one is aplastic anemia, one is anemia of chronic disease. So what are the five major classification? Hemorrhagic, hemolytic, nutrition deficiency, aplastic, anemia of chronic disease. So let us start one by one. First of all, the hemorrhagic anemia. The hemorrhagic anemia is referred as the hemorrhage means the excessive loss of the blood. So what is hemorrhage? Hemorrhage refers to excessive loss of blood, and anemia due to hemorrhage is known as hemorrhagic anemia, and it occurs both in acute and chronic hemorrhagic condition. So in case of hemorrhage, there are two conditions: one is acute, one is chronic. So let us start with the acute hemorrhage. So what is acute hemorrhage? Acute hemorrhage refers to sudden loss of a large quantity of the blood, as in case of accident. So what happens here? Within about 24 hours of the hemorrhage, the plasma portion of the blood is replaced. However, the replacement of RBC does not occur so quickly, and it takes at least 4 to 6 weeks to recover. And so, with less number of RBC, the hemodilution occurs. And however, the morphologically the RBC has normocytic and normochromic, but the decreased RBC count causes hypoxia, which stimulates the bone marrow to produce more and more number of RBC. So the condition is corrected within 4 to 6 weeks. Now, chronic hemorrhage. Chronic hemorrhage, it refers to the loss of the blood by internal or external bleeding over a long period of time, and it occurs in conditions like the peptic ulcer, porphyria, hemophilia, and menorrhagia. So what are the conditions? One is peptic ulcer, porphyria, hemophilia, and menorrhagia. So these are the conditions in which you can find the chronic hemorrhage. Now, due to the continuous loss of the blood, lot of iron is lost from the body, causing iron deficiency. This affects the synthesis of the hemoglobin, resulting in less hemoglobin content in the cells. Now the cells are also become small, hence the RBC are microcytic and hypochromic. Now, let us start with the hemolytic anemia. The hemolysis means the destruction of RBC, and anemia due to excessive hemolysis which is not compensated by increased RBC production is called hemolytic anemia, and it is classified into two types. One is extrinsic hemolytic anemia, one is intrinsic hemolytic anemia. Now, first of all, what is extrinsic hemolytic anemia? It is the type of anemia which is caused by the destruction of RBC by external factors. Healthy RBC are hemolyzed by the factors outside the blood cells such as antibodies, chemicals, and drugs. And extrinsic hemolytic anemia is also called autoimmune hemolytic anemia. And common causes of external hemolytic anemia are liver failure and renal disorder. So these are the common cases. In case extensive hemolytic anemia, you can also found in liver failure, renal disorder, except that hypersplenism, then burns, then infection like hepatitis, malaria, and septicemia, then drugs like penicillin, antimalarial drugs, and sulfur drugs, then poisoning by lead, coal, and tar, then presence of isoagglutinins like the anti-RH, and then the autoimmune disease also, the like rheumatoid arthritis and ulcerative colitis, and this type of anemia are normocytic and normochromic. And in case of intrinsic hemolytic anemia, the reasons are hereditary disorders like sickle cell anemia and thalassemia. So, what are the reasons? In the common causes of external hemolytic anemia are liver failure, renal disorder. Then we have already discussed about the hypersplenism, then burns, then infection like hepatitis, malaria, and septicemia. Then drugs such as penicillin, antimalarial drugs, and sulfur drugs. Then poisoning by chemical substances like lead, coal, tar. Then presence of isoagglutinins like anti-RH. Then autoimmune diseases such as the rheumatoid arthritis and ulcerative colitis. So these are the major regions in which the extrinsic hemolytic anemia may be occurred. And intrinsic hemolytic anemia, it is a type of anemia caused by the destruction of RBC because of the defective RBC, and there is production of unhealthy RBCs which are short-lived and destroyed soon. And the intrinsic hemolytic anemia is often inherited, and it includes like sickle cell anemia and thalassemia. These are the hereditary disorder. Now, because of the abnormal shape in the sickle cell anemia and thalassemia, the RBC become more fragile and susceptible for hemolysis. Now, first discuss about the sickle cell anemia. What is sickle cell anemia? Sickle cell anemia is an inherited blood disorder characterized by the sickle shape of red blood cell, and it is also called hemoglobin SS disease or sickle cell disease. It is common in the people in the African region, and sickle cell anemia is due to the abnormal hemoglobin called hemoglobin S. or sickle cell hemoglobin, and in this alpha chain or normal and beta chains are abnormal. The molecules of hemoglobin S polymerize into long chains and precipitate inside the cells. Because of this, the RBC attain sickle or crescent shape and become more fragile and leading to hemolysis. You can see in the diagram clearly. This is the diagram of sickle cell anemia. The RBC shape are not in normal condition. You can see that. Then sickle cell anemia occurs when a person inherits two abnormal genes, one from each parent, and in children the hemolyzed sickle cell aggregate and block the blood vessels, leading to infraction or stoppage of blood supply. And the infraction is common in small bones. The infracted small bones in hand and foot results in varying length and the digits. And this condition is known as hand and foot syndrome. And jaundice is also occurs in these children. Now discuss with the thalassemia. Thalassemia is also an inherited disorder and which is characterized by the abnormal hemoglobin. It is also known as Colles anemia or Mediterranean hemoglobin anemia. So the another names of thalassemia are Colles anemia or Mediterranean anemia, or in Bengali you also known as Bhumodhosagariya anemia. It is more common in Thailand and to some extent in Mediterranean countries. Thalassemia is of two types. One is alpha, one is beta thalassemia. So what is the two types? What are the two types? One is alpha thalassemia, one is beta thalassemia. Now the beta thalassemia is very common among these two. Okay, in normal hemoglobin, number of alpha and beta polypeptide chains is equal, and the production of this in normal hemoglobin, the number of alpha and beta polypeptide chains is equal. In thalassemia, the production of these chains become imbalanced because of the defective synthesis of the globin genes, and this causes the precipitation of the polypeptide chains in the immature RBC and leading to disturbances in the erythropoiesis. And the precipitation also occurs in the mature red cells, resulting in hemolysis. Now, first, the alpha thalassemia. Alpha thalassemia occurs in the fetal life or infancy. In this, the alpha chains are small, less, absent, or abnormal. And in adults, the beta chains are in excess, and in children, the gamma chain are in excess. This leads to defective erythropoiesis and hemolysis. This in the infants may be stillborn or may die immediately after birth. Then beta thalassemia. In case of beta thalassemia, the beta chains are less in number, absent or abnormal with an excess of alpha chains. The alpha chains precipitate, causing defective erythropoiesis and hemolysis. So this is our today's topic. Today we have covered two types of anemia. One is hemorrhagic and one is hemolytic. So if you have any query or any doubt related to these topics, you can all ask your question in the comment section. I will try to reply them all. You can also do like, share and subscribe to my channel for supporting me and my channel, and thank you so much for watching the entire video.